Good morning. We are coming to you live from the Texas Medical Center as KPRC2 celebrates May Heroes today, recognizing the heroes in our medical community. This is first for us here at the Texas Medical Center, the heart of the Texas Medical Center. It's really a day to celebrate all of our frontline healthcare workers. Over the past year, we've witnessed their sheer acts of humanity, their bravery, and their sacrifice.
Selflessness to the max, right? They've embodied all that, and it's a beautiful day.
Glorious.
To host something like this, right? Good to be next to you, Andy Sirota. I'm Lisa Hernandez. Over the past year, these heroes have really helped save lives throughout the pandemic, from the doctors and the nurses to those working behind the scenes to keep us all safe. Throughout the day, we will be recognizing their efforts.
All right, want to go to our KPRC2's Haley Hernandez. She is leading our coverage here from the Texas Medical Center this afternoon. Houston's only health reporter. Haley, you spoke with one nurse who not only helped patients during the pandemic, but also made history.
Yeah, of course he did. So, you know, when the producers told me that we were going to be doing this show and they said they wanted to highlight some heroes, the first person I thought of was Robert Lucky. He's a nurse at Memorial Hermann, and he was the first in our area, possibly all of Texas, to receive his COVID-19 vaccine. And that is the day that I met him. On that day, the words that he told me really struck me. Seconds after he got his vaccine, he told me he was now going to go back to the COVID ICU and tell the patients who were suffering that hope is coming. Last week, I sat down with Robert again for a follow-up.
You were kind of the epitome of our frontline heroes, the heroes that we've been talking about throughout this entire pandemic. A lot of what you said really hit me like, this is what it looks like. So how has it been in the last 4 months since receiving the vaccine?
I do have more of a peace of mind. Like whenever you're interacting with the patients, whenever you're inside of the rooms with the patients, you're more calmer, you're more collected. You know that you're protected.
Will you remind me, do you have family at home? How many kids do you have?
I have 5 kids.
That's great.
Yeah, it's great.
But I'm sure that you were concerned.
I was, yeah, absolutely. Some of my practices I don't change, like going out to the garage, changing over, things like that I would do like when we first got into it. But feeling comfortable where I can actually engage with them like I normally would, that does feel comfortable. That does feel a lot better.
Your previous career was in the Marines, right?
That is correct, yeah. I have been fortunate in life to be sitting here. I do feel fortunate.
Anybody else you've seen, like anybody else that you'd like to give credit to?
Yeah, that's actually a very good statement. The MICU that's here right now, because they take the blunt of all of the COVID patients that come inside of here. So they're, with them, you know, constantly being exposed to that does bother you after a certain point. So I just want to send a encouragement out to them and their families and everything like that, and their unit as a whole.
Now, Robert is quick to point out, obviously, this pandemic is not over. He says our foot is on the gas with a vaccine, and we cannot let up now. Now, since he took that first shot, a big percentage of our area has received their COVID-19 vaccine. But experts say we need to get that to 70 to 80% to achieve that herd immunity before we can move past all of the COVID precautions. But Robert agrees that there is an end in sight, and that's why we are here to thank them for getting us to this point. Andy, Lisa?
Absolutely, Haley. And was he ever able to have a personal conversation with his patients about what he thought would be coming here?
Yeah, so remember, during the pandemic, there have been these restrictions on visitor policies at the hospital. So Robert reminds me that he and other nurses like him were the ones who had to go back and talk to these patients and comfort them and let them know what was happening outside of the hospital. So many of them were so out of it. So they were the only personal connections that these patients had the whole time that they've been suffering with COVID-19. So yes, he was able to go back to his patients and let them know that the end is in sight. Guys.
And